Good evening, everybody. In yesterday's class, we have discussed about alpha agonist, and in today's class, let us try to learn about alpha blockers and important questions which are usually asked in the examinations from alpha blockers. So let's begin this session. Usually, the first question: the following drugs causes hypotension through alpha 1 blocking action but causes tachycardia, palpitation, and arrhythmia due to alpha 2 inhibition. So there are some drugs, the drugs which causes hypotension through alpha 1 action, and they causes tachycardia, palpitation, and arrhythmias due to alpha 2 action. So to solve this question, let me tell you, in alpha blockers, we have these many drugs. Before that, we already know that alpha receptors are two types, alpha 1 and alpha 2. Alpha 1 receptors are mainly present on blood vessels, GI sphincter, and urinary sphincter. And alpha 2 receptors are present on beta cells, ciliary epithelium, sympathetic nerve ending, and again blood vessels. So these are some locations of alpha 2 receptors. When alpha 2 receptors are blocked and when alpha 1 receptors are blocked, it will show all these actions. In previous classes we have seen what actions were shown with these receptors. Now let's go back. I'm sorry. Let's try to understand the classification of alpha blockers. In alpha blockers we have non-selective alpha blockers. Non-selective alpha blockers will block on both alpha 1 and alpha 2. And selective alpha blockers, these are particularly alpha 1 blockers. And this is particularly alpha 2 blockers. In alpha 1 and alpha 2 non-selective blockers, we have ergot alkaloids and hydrogenated ergot alkaloids. Actually, these are the drugs actually used in migraine. These alkaloids and hydrogenated ergot alkaloids like ergotamine, ergotoxin, hydroergotamine, and dihydroergotoxin, these all drugs will have both alpha 1 agonist action and alpha 2 agonist action. Along with agonist action, they are also having alpha 1 and alpha 2 blocking activity. So due to the unspecific actions, due to the agonist and antagonist actions of these ergot alkaloids, we don't use these drugs commonly for alpha blocking activity. So usually these ergot alkaloids are used in migraine. Anyways, we are not discussing about migraine, so this category of drugs we will skip in this session. One thing you have to understand, ergot alkaloids along with alpha agonist action, they are also having alpha 1 and alpha 2 blocking activity. And the next one, we have imidazolines. In imidazolines, we have tolazoline and phentolamine. In beta haloalkylamines, we have phenoxybenzamine. These two classes of drugs are having alpha 1 blocking activity and alpha 2 blocking activity. When alpha 1 blocking activity is seen with these drugs, it will decrease blood pressure. And when alpha 2 blocking activity is seen, it will cause tachycardia, because when alpha 2 receptor is blocked, it will increase the secretion of noradrenaline, and this noradrenaline will go and act on heart, and it will cause tachycardia, palpitation, and arrhythmias. So tolazoline, phentolamine, and phenoxybenzamine, or these three drugs will block alpha 1 and alpha 2 receptors. When alpha 1 receptor is blocked, it will relax the blood vessels, and by that it will decrease blood pressure. But when alpha 2 receptor is blocked, it will cause tachycardia, palpitation, and arrhythmias. It increases heart rate. Heart activity is increased due to increased noradrenaline. And we have some other drugs, actually chlorpromazine. This chlorpromazine is also alpha blocker, but it's mainly studied in antipsychotic drugs. Along with antipsychotic activity, chlorpromazine also has alpha blocking activity. Anyways, about these drugs we'll study in the later classes. So imidazolines and beta haloalkylamines are the drugs which are non-specific or non-selective alpha blockers. And in alpha 1 selective blockers, we have prazosin, terazosin, doxazosin, tamsulosin. And in alpha 2 selective blockers, we have yohimbine. Yohimbine particularly blocks alpha 2 receptors. When alpha 2 receptors are blocked, it will increase the release of noradrenaline, and when noradrenaline is released, it will cause all heart actions. Heart rate increases, blood pressure increases, and everything. Selective alpha 1 blockers particularly, they block the alpha 1 receptors, and by that it will show, it will be helpful in, actually when alpha 1 receptor is blocked, it will cause vasodilation, and when alpha 1 receptor is blocked in GA tract, it will relax the GA sphincters, and again on the urinary sphincters it will relax the sphincters. So when alpha 1 receptor is blocked, it will mediate the movement of gastric contents in the GI tract, and it will be helpful for movement of urine from the bladder when alpha 1 receptor is blocked. So terazosin, dexazosin, prazosin, tamsulosin, all these drugs will help in defecation and will help in urination, and along with that it dilates blood vessels and it is helpful in hypertension as well. These are some examples of drugs from alpha blockers. Let's go back to the question. The question what he is asking, name the drugs or give the examples of the drugs which will cause hypotension due to alpha 1 activity and tachycardia due to alpha 2 activity. See, phentolamine and phenoxybenzamine are non-selective alpha blockers. They will block alpha 1 and alpha 2. By blocking alpha 1, it will cause hypotension, and by blocking alpha 2, it will cause tachycardia. So first option is correct option. Why the other options are wrong, I'll explain. See, we have tamsulosin. Tamsulosin is particularly alpha 1 blocker. Tamsulosin has no alpha 2 actions. And dutasteride is 5 alpha reductase inhibitor. 5 alpha reductase inhibitor. This dutasteride or this enzyme, actually 5 alpha reductase enzyme, converts testosterone into dihydrotestosterone. Dihydrotestosterone. This dihydrotestosterone further goes and acts on the prostate gland, and it increases the prostate gland activity. Prostate gland activity. I mean, prostate size will increase. So when this 5 alpha reductase enzyme is blocked by dutasteride, dutasteride is 5 alpha reductase inhibitor. When this enzyme is inhibited, it will not convert testosterone into dihydrotestosterone. Actually, testosterone is inactive and dihydrotestosterone is active. This activated form of dihydrotestosterone is helpful in producing prostate tissue. So prostate gland size increases with dihydrotestosterone. So we are inhibiting conversion of testosterone to dihydrotestosterone. So dutasteride and tamsulosin, both combination drugs are used in benign prostatic hyperplasia. Benign prostatic hyperplasia (BPH). So this option is not at all related to the question because tamsulosin is having alpha 1 activity, dutasteride is having 5 alpha reductase activity. But in the question is asking alpha 1 activity and alpha 2 activity. So option 2 is wrong. And the third option is yohimbine and ergotamine. As I was telling, ergotamine is used in migraine, which is having both alpha agonist activity and alpha antagonist activity. So this question is not related to ergotamine. And yohimbine is particularly alpha 2 blocker. It is having alpha 2 inhibition activity, but it has no alpha 1 activity. So option C is also wrong. And none of the above is no, because here already option A is correct, so this option is wrong and this option is also wrong. I think this first question is clear to you all. We'll go to the next question. Question 2. Which of the following is a uroselective alpha 1 blocker? Among alpha blockers, you see, I was explaining in alpha blockers, prazosin, terazosin, doxazosin, tamsulosin. These are alpha 1 blockers particularly. In those, in those all alpha 1 blockers, which one of the following drug is uroselective? Prazosin, terazosin, doxazosin, and tamsulosin. Remember here, tamsulosin particularly blocks the alpha 1 receptors which is present in the bladder, especially. Whereas prazosin blocks on blood vessels as well as in the GI tract. Terazosin acts on blood vessels as well as in the GI tract, and doxazosin also the same. Whereas tamsulosin is the only drug among alpha 1 blockers. It is selective. It is uroselective alpha blocker, which will block alpha 1 receptors, especially on the urinary sphincter. So, because of this alpha 1 uroselective activity, tamsulosin is particularly used in benign prostatic hyperplasia. Benign prostatic hyperplasia. So, what do you know about benign prostatic hyperplasia? Just now I was explaining you. Actually, in some cases, especially in males around the urethral duct, there is a gland called prostate gland. Sometimes the prostate gland size will increase due to overactivity of dihydrotestosterone. Dihydrotestosterone. So this dihydrotestosterone overactivity increases the size of prostate gland, and due to that, the duct which excretes the urine from the bladder through urethra, the lumen size decreases, and it becomes a very difficult for the patient to urinate. So in that case, what happens? In this case, we will prescribe tamsulosin, which will inhibit the alpha 1 receptors here, and by that it will relax this sphincter. And along with tamsulosin, we use dutasteride, which will inhibit 5 alpha reductase enzyme, and by that it will decrease the activity of dihydrotestosterone. So tamsulosin and dutasteride are the drugs which are given in combination in benign prostatic hyperplasia. I think this point is clear to you. Now the question is very simple. Among all the following alpha 1 blockers, which one of the following drug is uroselective alpha blocker? Among all these drugs, tamsulosin is uroselective alpha blocker. Simple. Other drugs will block alpha receptors on urinary bladder as well as on the GI tract as well as on the blood vessels. But tamsulosin is the only drug which will block especially on the urinary bladder. I think this question is also clear to you all. Now we'll go to the third question. Phentolamine test. Phentolamine test is used to diagnose which disease condition? We have many disease conditions. In that disease conditions, phentolamine test is usually used. What is phentolamine test is? Actually, phentolamine is available in oral form as well as in IV form. And IV phentolamine is having a rapid onset of action. IV 5 mg, 5 mg IV phentolamine is injected into the patient over 1 minute, and in this time, if the patient's blood pressure falls less than 35 mm Hg, 35 mm of Hg systolic blood pressure, then that condition or that test is called phentolamine test. Actually, phentolamine test is used to check whether the patient's blood pressure is decreasing or not. Actually, this test is performed particularly in pheochromocytoma. Pheochromocytoma is a condition where the prostate gland of the kidneys, in the prostate gland we have, sorry, not prostate gland, I was sorry, in adrenal gland we have adrenal medulla. In the adrenal medulla, due to the formation of tumors in the adrenal medulla, more amount of adrenaline is released. More amount of adrenaline, because adrenal medulla synthesizes adrenaline. When adrenal gland has tumors, it will synthesize more adrenaline. So more amount of adrenaline will act on alpha and beta receptors, and by that it will cause hypertension. Patient will have hypertension. This condition is called pheochromocytoma. Pheochromocytoma is the condition where large amount of adrenaline is synthesized from adrenal medulla, which is characterized by hypertension, which is also characterized by tachycardia, palpitations, and all heart reactions will be seen. So in that case, phentolamine injection is injected 5 mg, and through that, if blood pressure decreases, if it falls less than 35 mm Hg of systolic and 25 mm Hg of diastolic, then that test is called phentolamine test, or that test is useful for a diagnosis of pheochromocytoma. So answer for this question is C. Directly explained the answer. Why phentolamine test is not used in benign prostatic hyperplasia? Because phentolamine has nothing to do with benign prostatic hyperplasia, because phentolamine acts on both alpha 1 as well as alpha 2. For benign prostatic hyperplasia, we want alpha 1 activity. Anyways, for benign prostatic hyperplasia, phentolamine test is not used. For hypertension, we don't use phentolamine test. And for aphrodisiac, we don't use phentolamine test. So actually, aphrodisiac is the condition where patient will have patient will have more sensitivity, or patient will have more sex drive. So patient will have more sex drive. Sex drive will increase. That condition is called aphrodisiac. Why this point is given in alpha blockers is because there is a drug called yohimbine. Yohimbine is alpha 2 blocker particularly. When yohimbine is given, some people believes that yohimbine will cause aphrodisiac. Yohimbine will increase the perception of sex perception, or sex intensity will increase, sex drive will increase. Like that, many people believe that yohimbine will cause aphrodisiac activity. So aphrodisiac is nothing to do with phentolamine test. So none of the above is wrong. Aphrodisiac activity is wrong. Pheochromocytoma is correct, because phentolamine test is used in pheochromocytoma to diagnose pheochromocytoma. Hypertension and benign prostatic hyperplasia has no role with phentolamine test. So I think third question is clear to you all. Let me summarize. Phentolamine test is used to diagnose pheochromocytoma. In phentolamine test, 5 mg phentolamine IV injection is given over 1 minute, and in that time, if 35 mm Hg of systolic blood pressure is decreased, that condition is called pheochromocytoma, or that test is helpful to diagnose pheochromocytoma. Simple. And next, fourth question. The most common adverse effect which is seen with alpha 1 blocker, alpha 1 receptors, when alpha 1 receptor is blocked, all blood vessels will be dilated and through that patient will develop hypotension. So which is the common adverse effect with alpha 1 blocker is the question. In that we have tachycardia, hypertension, impotence, and first dose phenomenon, postural hypotension. Simple, when alpha 1 blockers are given, blood vessels will be dilated and patient will develop hypertension, particularly postural hypertension. When a patient stands immediately after taking the drug, patient will have hypotension. Patient's blood pressure will fall down rapidly. That is called postural hypotension. So postural hypotension is seen with alpha blockers, not impotence. Impotence is not seen with alpha blockers. Sometimes, if a patient is having benign prostatic hyperplasia, in that cases, when alpha 1 blockers are given, patient may have retrograde ejaculation. In that case, impotence can be seen, but this is very rarely seen. And hypertension is not at all seen because alpha 1 blockers causes hypotension, no hypertension, and no tachycardia. Okay, so the common adverse effect seen with alpha blockers is postural hypotension. Simple. Sometimes patient may have diarrhea, sometimes patient may have defecation, and due to the blockade of alpha receptors, nasal congestion or stuffy nose can be seen sometimes. But the most common and dangerous adverse effect is postural hypotension. Fourth question is also very easy. Now we'll go with fifth question. Intravenous phentolamine. Just now we have seen phentolamine test. Intravenous phentolamine can be used in the following condition. Is the question. Phentolamine, IV phentolamine is used in all these conditions. I'll tell you why. See, phentolamine is used, actually phentolamine blocks alpha 1 and alpha 2 receptors. And phentolamine is drug of choice in pheochromocytoma. This point you have to remember. Not only phentolamine, phenoxybenzamine also drug of choice in pheochromocytoma. Phentolamine controls hypertensive episodes intraoperatively during surgery. Actually, when patient is having pheochromocytoma, in this condition, in surgery conditions, we will use phentolamine. And phentolamine is also useful to control hypertension due to clonidine withdrawal. Actually, in yesterday's class, previous class, I was discussing you. Clonidine is the alpha agonist, especially alpha 2 agonist. When alpha 2 agonist is given, it will decrease the release of noradrenaline, and by that, it will be helpful in hypertension. It will decrease hypertension. Sometimes, when clonidine is given, clonidine suddenly when it is stopped, I'm sorry, when clonidine is stopped, patient will develop severe hypertension. Clonidine is the centrally acting antihypertensive drug. When clonidine is stopped or when clonidine is withdrawn, patient will develop severe hypertension. So in that cases also to treat hypertension, phentolamine injections are used. Phentolamine intravenous administration is used. And phentolamine is also used to control hypertension due to cheese reaction. Let me tell you about cheese reaction. Actually, in previous classes, I was telling you there is an enzyme called MAO, monoamino oxidase. Monoamino oxidase A and monoamino oxidase B. Actually, we have some drugs called monoamino oxidase inhibitors, MAOIs. When MAOI, monoamino oxidase inhibitor, is given, this enzyme will be blocked, and when this enzyme is blocked, patient will have increased noradrenaline. I'm sorry. Increased noradrenaline is seen when MAO is given. And see, actually, when MAO inhibitors are given, Along with that, if patient takes cheese, or if patient takes wine, or if patient takes the diet which contains lot of tyramine, this tyramine will directly act like noradrenaline, and this tyramine will not be, I mean, the tyramine activity will be increased, and it will show all noradrenaline actions. Due to that, patient will have severe hypertension crisis. So that condition is called cheese reaction. Cheese reaction is nothing but when a patient is taking monoamine oxidase inhibitor. Along with that, if patient takes a lot of cheese which contains excess tyramine, so patient's tyramine action increases. Directly it acts like noradrenaline, or conversion of tyramine to noradrenaline will increase, and patient will develop hypertensive crisis. So in cheese reaction also, phentolamine injections are given. So phentolamine is used in pheochromocytoma hypertension. It is used in pulmonary withdrawal hypertension. It is used in cheese reaction hypertension. So all the above is the correct option for fifth question. I think I'm sorry. These five questions are okay to you all. In tomorrow's class, I'll come with some other questions from beta blockers. So that's it for today. Thank you all for joining.